Hannah's asked about your thoughts on people having to take antibiotics post-splenectomy, and also on teenagers being offered long-term antibiotics for acne, which I know is something you specifically covered in your book. And you've got your own teenager now.
Yeah. I have my own teenager with acne, so God love him. So yeah. Oh, okay. So I spend a lot of my time treating people. In fact, I had a patient this week on Lymecycline for 3 months who turned up in my clinic wanting to know why they suddenly had diarrhea and an altered bowel habit. And I really struggle with it. I mean, I think the first thing to say is that acne is a terrible condition and we shouldn't belittle it. You know, it's deforming and it really destroys people's lives. And I fully understand that people need treatment for it and that this should be taken seriously. I think the microbiome is a great opportunity, though, to change the way we think about acne, because of course the skin microbiome plays a very important role in explaining why we get acne, but so does the gut microbiome, and actually it presents us with new targets through which we can treat it. And I think you're going to see that come through, and I'm really excited about that. I think that's going to be like a major growth area in terms of skin health. So yep, I think, you know, splenectomy, a different ball game. You know, your risk of having Haemophilus influenza, dying from, you know, a capsulated microbe that causes sepsis, is probably outweighs the benefit of having a penicillin. And it's typically a penicillin that we give, and penicillin disrupts the microbiome in less dramatic ways than a macrolide, but of course over a lifetime of having it, it's going to have an impact. And it's a risk-benefit situation where you're going to have to just make the call in the better you know, half of that kind of equation. But of course, then thinking about your gut health is going to be very, very important. Just as a side note, what we know is that the microbiome plays a very big role in influencing how vaccines work. So, you know, many of these splenectomy patients obviously need to be vaccinated. It's very important. And having a diverse microbiome that is optimized and healthy will have a big impact on the efficacy of those vaccines, which is why part of the reason why things like influenza vaccines work very differently in Europe than they do in Africa.